Eastern Idaho Regional Medical Center is moving its Soda Springs Air Idaho Rescue Ambulance helicopter to a base right at the hospital. EIRMC officials say this is largely to accommodate specially trained patient transport teams, namely the Neonatal Intensive Care Unit, or the NICU transport team. EIRMC is the only level 3 NICU in the area, providing the highest level of care in the region. In the past, the helicopter based in Driggs was forced to come up to transport team at EIRMC before heading to transport premature babies and their mothers to the EIRMC NICU. This essentially doubled the flight time.
Being a helicopter here will allow us to improve those flight times and get our teams to the bedside where the patients need us as quick as possible, and we'll be able to cut our flight times for those types of patients in nearly half.
The NICU transport team is made up of a nurse practitioner, a flight nurse, and a respiratory therapist. They come equipped with a special isolate unit for the baby, which is fitted for the helicopter. EIRMC officials say their key critical moment comes right after delivery. They're trained to resuscitate babies as young as 22 weeks gestational age.
About minutes, how much that means to a baby as they're struggling to breathe. As people out in the field that aren't familiar with those tiny little babies, it really can mean the difference between life and death. It could be the difference between long-term poor prognosis, developmental delays, cerebral palsy, other complications of prematurity.
EIRMC officials say moving the helicopter out of Soda Springs will not greatly affect patients in that area.